We are going to see about necrosis. Necrosis, which is defined as a localized area of death of a tissue followed by degradation of tissue by hydrolytic enzymes liberated from the dead cells. It is invariably accompanied by inflammatory reaction. Various agents such as hypoxia, chemical and physical agents, microbial agents, immunological injuries, etc. There are two essential changes which characterizes the irreversible cell injury in necrosis of all types. They are cell digestion by lytic enzymes and denaturation of proteins. Types of necrosis. Morphologically, there are 5 types of necrosis. They are coagulative necrosis, liquefaction necrosis, caseous necrosis, fat and fibrinoid necrosis. Coagulative necrosis. It is a form of tissue necrosis in which the basic component of the cells are dead, but the basic tissue architecture is preserved for at least several days. The affected tissue take on a firm texture. Presumably, the injury denaturates not only the structural protein but also enzymes and so, which blocks the proteolysis of the dead cells. As a result, eosinophilic anucleated cells may persist for days or weeks. Ultimately, the necrotic cells are removed. Phagocytosis of the cellular debris can occur. Coagulative necrosis. It is the most common type of necrosis. Mostly occurs from the sudden cessation of the blood flow, which is known as ischemia. Less often from bacterial and chemical agents. It is a characteristic feature of the infarcts. Areas of ischemic necrosis in all solid organs can occur except brain. The organs commonly affected by the means of coagulative necrosis are heart, kidney and spleen. Grossly, the foci of coagulative necrosis on the early stage appears pale, firm and slightly swollen. With the progression, they became more yellowish and softer and shrunken. Microscopically, the hallmark of coagulative necrosis is the conversion of normal cells into their tombstone's appearances. Outline of these cells are retained, but the cytoplasmic and nuclear details are lost. The necrosed cells are swollen and appears more eosinophilic than the normal, along with the nuclear changes which is described above, but the cell digestion and liquefaction fail to occur. Eventually, the necrosed focus is inflated by some inflammatory cells, and the dead cells are phagocytosed, leaving a granular debris and the fragments of the cells. Coagulative necrosis. The affected area on the right, which shows the cells with intensely eosinophilic cytoplasm of tubular cells, but the outline of the tubules are still maintained. The nuclei shows granular debris. The interface between the visible and non-visible area shows non-specific inflammation and the proliferating vessels. Liquefaction necrosis, which occurs due to the ischemic injury and the bacterial or fungal infections. Degradation of tissue by the action of powerful hydrolytic enzymes. The common examples are infarct of brain and the abscess cavity. Whatever the pathogenesis, liquefaction, which is completely digests the dead cells, resulting in transformation of the tissue into a liquid viscous mass. If the process was initiated by acute inflammatory material, is frequently which is creamy yellow and is often called as pus. This is the gross image which shows the liquefaction necrosis of the brain. Grossly, the affected area is soft with liquefied center containing necrotic debris. Later, a cystic wall is formed. Microscopically, the cystic space which contains necrotic cell debris and macrophages which is filled with phagocytosed material. The cystic wall is formed by the proliferating capillaries, inflammatory cells and gliosis, which means proliferating glial cells in case of the brain. Proliferating fibroblasts in case of the abscess cavity. This is the image which showing the liquefaction necrosis of brain. The necrosed area on the right side of the field, which shows a cystic space which contains cell debris, which is while surrounding zones showing shows some granulation tissues and gliosis. Caseous necrosis, which is found in the center of foci of tuberculosis infection. It combines a feature of both the coagulative and the liquefactive necrosis. The term caseous, which means cheese-like, is derived from the friable yellow-white appearance of the area of necrosis. This is the images of lung which is affected by caseous necrosis. Grossly, foci of caseous necrosis, as the name implies, which resembles dried cheese and are soft, granular and yellowish. This appearance is partly attributed to the histotoxic effects of lipopolysaccharides, which is present in the capsule of tubercle bacilli known as Mycobacterium tuberculosis. Microscopically, the necrosed foci are structureless, eosinophilic, and containing granular debris. The surrounding tissue shows characteristic granulomatous inflammatory reaction, which consists of epithelioid cells with interspersed giant cells of Langerhans and or foreign body type, and the peripheral mantle of lymphocytes. This is the histopathological images of caseous necrosis of lymph node, which shows the eosinophilic amorphous granular material, while the periphery shows the granulomatous inflammation. Fat necrosis, which refers to the focal areas of fat destruction. Acute pancreatic necrosis and traumatic fat necrosis commonly in breast. Pancreatic enzymes that have leaked out of acina cells and ducts, which liquefies the membranes of fat cells in periosteum, and lipases split the triglyceride esters contained within fat cells to fatty acid, which combines the calcium to produce grossly a chalky white appearances known as fat saponification. This gross image, which shows the fat necrosis of acute pancreatitis. The areas of white chalky deposits represents the foci of fat necrosis with calcium soap formation at the site of lipid breakdown. Grossly, the fat necrosis appears as a yellowish white and firm deposits. Formation of calcium soap, which imparts the necrosed foci firmer and chalky white appearances. Microscopically, the necrosed fat cells have cloudy appearances, which is surrounded by an inflammatory reaction. Fibrinoid necrosis, which is characterized by the deposition of fibrin-like material which has the staining properties of fibrin. It is encountered in the various examples of immunological tissue injury, namely immune complex vasculitis, autoimmune diseases, arthritis reaction, and arterioles in hypertension and peptic ulcer. The histopathological images shows the fibrinoid necrosis of patient with polyarteritis nodosa. The wall of the artery shows a circumferential bright pink area of necrosis with the protein deposition and dark nuclei of neutrophils. Microscopically, which is identified by brightly eosinophilic hyaline-like deposition in the vessel wall. Necrotic focus is surrounded by nuclear debris of neutrophils. Local hemorrhages may occur due to the rupture of the blood vessels. Thank you.